Thank you, Dr. Huang. Okay. One of the questions that was asked was, Dr. Huang, I have a cancerous wall tumor. And I will be going for a resection surgery on 25th April. The tumor is 18 mm. In the meantime, what herbs, food, or things I should do to try to reduce the size of tumor?
Okay, the first thing we have to know is that currently there is no proven evidence that any kind of herb or any kind of things other than chemotherapy or radiotherapy that can really make the cancer mass shrink or become smaller. This is the first thing that we have to know. Yeah. So if you focus on treating the mass to make it smaller, then actually it's more kind of focusing on the tumor instead of the whole body. Let's say, just like I said, we have to mind our toxins in our body and also our emotional status and also the traumas during our lifetime. These three things that contributed to form a cancer that we have to treat on these three parts that we can really cure the cancer. But if you just want to make the mass smaller, then chemotherapy or radiotherapy will be the best choice. But you have to mind that it may generate some side effects. But there's another thing to say is that, but in such a situation or such a case, we can apply some vegetables, just like if we eat 8 units of vegetable or fruit that can prevent cancer. Or let's say in the current news, WTO, they suggest it's good to eat 7 units a day that can lower down the risk to 42%, that you can live longer and can prevent cancer. And this method is the way that those large quantity of vegetables that can really lower down your free radicals, and it can make your bowel move smoothly without some residual stool or residual toxins in your GI system. So what to eat to make your cancer mass smaller? My answer is that no, there's nothing can really make your cancer mass smaller. But if you eat like 5 units or 2 or 7 units, 1 unit is regarded as 80 grams of vegetable or fruits that can really lower down your free radicals and can help your GI system better. But if you apply this kind of method that you want to eat like 7 units of vegetables or fruits, then you have to be very careful if your blood circulation is good enough. That is, if your palm, the palm of your hands, or the foot pad, if the temperature is not good enough, and maybe it's not hot enough, that means that you have the cold palm and cold foot pad. Then you have to be careful, because if you eat too much vegetables or fruits, then those antioxidants or anti-free radical chemicals in in the vegetable may lower down your blood circulation. So in this way, some people, if their blood circulation is poor, then those people are suggested to eat cooked vegetables or fruits instead of raw or fresh vegetable or fruits. This is something we have to be very careful about. Okay?
Okay, good. Dr. Huang, another question.
Yeah.
First stage breast cancer.
Yeah.
Doctor advised the patient to strongly go for chemotherapy and radiotherapy, but the patient wanted to use natural medicine.
Yeah.
And the family members gave her a lot of pressure.
Yes.
What should she do?
Well, the first thing that it is impossible that you can avoid the pressure from the family members. So the better way is a kind of compromised way. That means it's better that you can persuade them that you go for the conventional treatments, but at the same time, they would support you to have alternative medicine altogether at the same time. There will be more appropriate target or goal we can reach. Otherwise, if you create such big tension between you and your family members, that would not be very healthy to you and to your family members as well. So maybe, let's say, your family members wants you to follow the protocol of the doctor, then actually you can communicate with the doctor about how many courses of radiotherapy or chemotherapy you have to take. Like, you can talk to the doctor, because I feel very lethargy, weakness, and even dizziness, and my hair lost a lot, and my body cannot afford that much chemotherapy. Then the doctor may say, oh, okay, then we just call a stop or just a suspension in between. Then your family members can be persuaded by the doctor. And at the same time, you just tell your family members that you have your autonomy, that you want to receive or you want to take alternative medical service or medical help. Then I think it will be a better policy for you to apply to persuade your family. Is that clear?
Okay. Another two more question.
Yeah, please.
This cancer patient has used Dr. Huang your Dingyin Huang, 排毒配套. Yeah. Unfortunately, he went overseas, and then he caught the flu. So it's a lady. So her breast cancer had spread to lung, to the lung cancer. So her doctors and family members felt that she must use radiotherapy and chemotherapy to 切肺, to remove the affected tumor. But she's not willing, and she's scared. She's scared that it will spread further, but she's also scared that she will lose her lung. What is your advice to that?
Okay, so first, I don't know how severe, or let's say the severity of the disease, the infection or the cancer, the lung cancer, what kind of extension, what kind of stage now she is. Actually, I do not have enough information or data to investigate on. So, but from the question, I might guess maybe the situation is not so good. So the doctor will convince the patient or convince the family member to take more invasive procedure. So in such a situation, it's not a good position for me to give any advice, because I'm not well informed or well prepared with all the data. So in this situation, I might suggest the friend who asked me, maybe when I'm in Singapore, she can bring the data or the information or the history of hers or the lab data to me, that maybe we can have a discussion.
Okay.
And if not, then I don't think I will have enough data for me to make any right suggestion for her. Yeah?
Yeah, okay, that's fair enough. Dr.
Okay.
Huang, just
Yeah.
one more question more on
Yeah,
emotion.
please. Yeah.
There's this old man, he has been having periodic depression, and he had tried to use your Dingyiin Huang and
Yeah.
didn't seem to work very well. So especially during the 7月 or certain time during the 清明, when the attack came again, of course, the Pei Tao had helped him to shorten the depression period, but he is
Yeah.
not totally out of depression.
Yes.
So what should he do, or what should his family members do?
Okay. Periodic depression or all kind of depression related to some specific time. Like some people may happen in April or in May or in a specific month or several months. These are the depression that related to life trauma in particular month. Like a man has a depression in May, and that might be because that man lost his father in May in the previous years. Understand me?
Yes, yes.
So besides of physical health, we have to go to the life trauma to treat depression. And according to my experience now, I can treat depression patient in like 3 or 6 sessions that can cure without questions. So my suggestion is that I will encourage and invite the patient to go to my group sessions.
So for emotional therapy.
Yes, yes. Then if we treat just like the flow chart I explained before, if we treat the life trauma, then we can make the emotion much balanced. And when emotion is balanced, then the meridian system can be better, then the organ can be better, then the all kind of illness or kind of disease can be cured. So life trauma will be the root of all diseases. Yeah?
Okay.
So if we treat the life trauma, then his depression can be recovered as well.
So what you suggest is to go to the root of the problem.
Yes, so we just cut the roots. We go to the heart empowerment workshop and we do the group sessions. And it's now the most efficient and the fast way I can know up to now to cure depression. Because now mostly the psychiatric doctors claim that the depression cannot be cured, but it's not in my case because I have cured a lot of depression patients.
Yeah. I see. Dr. Huang, if you don't mind, I just ask you one last question.
Yeah, no problem. Yeah,
Okay,
please.
this is about ADHD.
Yeah.
多动儿 hyperactive children.
Yes. Yeah.
Can the parents take children with ADHD to you for treatment?
Yeah, definitely. No problem.
What are some of the success stories you have with ADHD?
Yeah, I have some successful cases in Holland and also in Hong Kong before, and also in Taiwan. Maybe I can explain a little bit about ADHD. ADHD is a kind of disease. Now it's not well well evidenced, but some study focus on the toxins, especially heavy metals in the brain. So I will apply, according to my experience, the kind of detoxification of heavy metals from the brain could be efficient and effective as well. And the second reason might be the residual toxin from the vaccination. Understand me? Yeah, when you inject vaccination, then the vaccination contains some heavy metals as well, or mercury compounds. So those are kind of chemicals that can damage our nerve system as well. And the third part will be the environment we have now, because mostly when I was very little, we could run on the farms. We can go to the brooks to catch streams. Then we have a lot of space and a lot of chance to exercise, to interact with nature. But now those children, they just live in a city. They lost the chance to interact with the nature. So their energy cannot be balanced by the nature, and it becomes a kind of agitated state of the child. So if we want to cure those kind of child, we have to detox the toxin in the body and in the brain, and also allow them to get in touch with nature.
To expand the energy.
Yes, to spend the energy and to interact with the nature, and the disease can be cured very easily. And some of them might result from traumas as well. Then maybe we can suggest those parents to have flower. My wife essence is a kind of flower essence, and also some group sessions to cure the parents. And it's very tricky that a lot of people say, "Oh, it's my child. Why you want to cure us?" Instead of cure my child, because mostly the existential being of the child is determined by the parents. Yeah? So if the parents can be healed with their life trauma, then a child can be normal or back to the tracks by this kind of approach.
Okay,
yeah?
Dr. Huang, would you say that this approach can also be used on autism?
Autism is something similar, but autism, according to my study, though my case is not that many, but according to my study, autism is a kind of panic or shocked trauma of the mother during the pregnancy. Understand me? Like when a woman, she has a baby and she was shocked, maybe by car accident, maybe by robbery, or maybe by any kind of disasters, then the mothers decide to close her up. Then this will become a mindset that the mother will put or transplant it into the child's brain. Yeah? So this something, according to my case, there's a case when the mother can be cured by group sessions. The boy can be improved in a very large scale, in a short period of time.
Okay, thank you so much, Dr. Huang.
Thank you.